name is Amnazo Muhirwa. I am a Sigma member and a grant recipient. I kind of joke around and say I'm somewhat of a professional student. And so I've always been in school. I have a degree in psychology, a nursing degree. I'm a nurse practitioner, and now I'm a PhD student. And so I love school, needless to say. Oftentimes within my research, I focus on a concept known as intersectionality, where you are looking at, as just the African American women, there are multiple identities that we embody. And so with each identity, there are unique experiences that you have, if you more specifically health experiences. So being both African American, being both women, and then residing in this socially disadvantaged communities like the rural community, all can really accumulate the level of stress that you are vulnerable to experiencing. And furthermore, if you want to look at things such as poverty, access to food, we can go deep into policies that are oftentimes implemented that may affect African American women. We see that among African American women, the rate of obesity is the highest among compared to any other racial ethnic group. We see that there are just a number of just disadvantages that this population specifically experience that marginalizes them and leads them to experience this accumulative level of stress that, of course, we know that stress is a social determinant of cardiovascular health and cardiovascular health disparity. And so when you have this accumulative stress of this intersectionality of multiple identities, that all of the identities are somewhat have their own oppressive experience, can lead to poor health outcomes. Within my research, one of the variables that I'm looking to measure is this American Heart Association measure of cardiovascular well-being. And in my background of doing this, researching this measure, I've seen that African American women are consistently underrepresented among studies measuring this. And so my hope is that through my study, we can not only be fully representing African American women and in measuring cardiovascular well-being, but also illuminate other factors in how the rural community impacts this measure, and so in hope to inform future interventions. Research is all about the future and new possibilities. I envision a world where the health of Black women is way better than what it is currently. And so what's exciting about my research is that I get to be a part of changing the face of health for Black women in particularly. And so not only as a Black nurse scientist and nurse practitioner, when you think about representation in a field where there's not a high percentage of minorities in this field, but also as a Black woman who also is navigating the healthcare system as a patient. I was looking and really familiarizing myself with really the mission of Sigma. And so one of the mission is developing nurse leaders anywhere to improve healthcare everywhere. And so that perfectly aligns with how well it's going to really impact my research. This grant means it's contributing to research that's hopefully going to contribute to literature and inform future interventions to improve the health of a very vulnerable population. And so that is such a significant impact, and it greatly aligns with the mission of Sigma. My current research is really focusing on a very specific group of African American women. And so, as we know, no group is a monolith. And so I'm hoping to, based on the findings, hoping to expand the population in which I target, perhaps not even rural women, and expanding it to other groups of women, and then also other women of color. And so, of course, this is, as a dissertation study, I know so many times students laugh, we want to do it all, but definitely based on the findings, I hope to expand to include other marginalized groups, other disadvantaged groups into my future work. To the donors, I would say thank you. Your contribution is not only going towards, funding innovative research, but know that the research that you are contributing to is helping achieve a more equitable healthcare community for so many populations. My research is going to incorporate culturally relevant frameworks to address, stress and cardiovascular health within rural African American women who experience a multitude of disparities and disadvantages. And so by your amazing donations, I'm able to do this work and launch a career as a nurse scientist to continue on this path of addressing health disparities in this field.